Hey, thanks so much, Diane, for kicking us off and getting us going. And thank you everyone for joining us today. My name is Storm Webb, and I'm happy to serve as the Executive Director for the National Childcare Association. We also have Cindy Lenhoff on the line with us. She's on her phone. She serves as our Director for the NCCA as well. We're very excited to be hosting today's webinar with Eric Cutler from TOOTRiS. So I'll hand it over to Eric to introduce himself, share a bit about his experience with ECE, and get our webinar started.
Thank you, Storm. Thank you, everybody, for attending on this beautiful Wednesday. My name is Eric Cutler. I am here based in San Diego, California, and I am a co-founder and chief data officer of a company called TOOTRiS. So I'm here today to share a little bit about what we've seen over the past year with parents and how their schedules and needs are adjusting due to the, of course, last 15 months of our health crisis, and help educate you on what we're seeing and how that can essentially help adapt your needs, your enrollment schedules, etc., as well as talk about how we are helping to tackle and solve the childcare crisis. Storm, without further ado, can you see my screen okay?
Yes.
So I'm just going to, we're 4 minutes in already. I'm already slacking, so I'm just going to go ahead and jump right in here. We did want to say that we are going to give away that iPad here, so we'll talk about that towards the end here. Each of us has our own story on why we're in childcare. Look at those chubby cheeks. That is me. I am a product of childhood investments. I'm not a child anymore. I'm an adult. I grew up in a single-parent household. My mom worked at Long's Drugs as a cashier and went to school on nights and weekends when she could. If it really wasn't for the daycares, for the after-school care when I was in elementary school, it wouldn't have afforded her the opportunity to get out from that cashier position. I probably wouldn't be here myself. So if it weren't for the child services and the opportunity and the stability that gave our little tiny family here in California. So, you know, I've worked in the technology space. I have a daughter now myself. There she is. There's grandma now. I am very involved in the local business community here. Childcare providers are businesses. Some people from the outside don't think about that, but they are a huge part of our economy. Nevertheless, the services that they provide working parents out there. So my central mission in life now with TOOTRiS is to fight for childcare access to make it equitable and really bring in all stakeholders to the table here. You know, childcare, if there's any silver lining over the last 15 months, it has really emphasized how important and critical childcare is to every facet of our economy. It's coming out of our politicians, our president on down, and now we're really talking about how important it is. The childcare piece of the American Rescue Plan Act has now front-loaded things like the child care tax credit. They've expanded it so parents are receiving up to $300 per month per child in order to help, you know, revitalize the industry and help parents thrive as they go back into the workforce. There is no more important time than the present, and part of what we do outside of what you'll see here in a little bit with TOOTRiS is work as an advocacy group, working, of course, with the National Childcare Association and others who have parallel goals, as well as work with folks locally in cities and state and federally to help push childcare at the top of the list. I think there's a certain feeling among the average American that, well, children are automatically going to be taken care of, everything's already set, and sometimes that really couldn't be further from the case. Our industry needs to have a seat at the table, and that's kind of part of what our mission is, to help drive that advocacy out there. So I want to talk a little bit about what we've seen from parents. We work with employers to help establish childcare benefits in their organization, their company, and part of that has been really it's a learning experience in that we've seen a pretty big shift over the past 15 or so months here. Companies are now really changing their policies, and why this is all going to be important is because ultimately this will kind of help you rethink and readjust your expectations on what parents are looking for in terms of enrollment. Many providers have set minimums as an example of what parents can enroll. Hey, parents can only enroll 2 or 3 days at minimum full-time care in my program. Hey, I'm not going to accept drop-in care, or maybe I'll accept drop-in daily care, but it has to be booked simultaneously, or I won't accept daily or hourly drop-in care. So all of these kind of expectations are now kind of put on ahead because of the changes that are happening in the employment sector, and with companies now shifting into multiple different work home environments. As an example here, we see that employees are now shifting a big swing. Almost half of employees are now offering some sort of either working full-time remotely, working part-time remotely, or at some point working back in the office. What does that mean? That means 15 months ago, while it was maybe cute to have my daughter kind of running in the background on a Zoom meeting, nowadays businesses are really trying to focus back in and work. That means even if I am working from home or working in a remote / in-office kind of schedule, I'm still going to need childcare, but it might be in a little different of a setup. Maybe I only need it 1 day a week when I'm going to actually be in the office, and I want to try to balance that home care environment. So those are the type of setups that you're going to have to start expecting that parents are going to need, and just from a mindset perspective, know that that's coming, if not already being asked today. We're also seeing, I've been in the employment business and ran organizations for about 20 years. I have never seen this many organizations offering remote only positions, right? It's now just about half, and before this was maybe about 10 to 15% of average employers here in America. This is important because this is now kind of changing the behavioral patterns that you'll expect from working parents that are coming to you for care. So again, this is just thinking about what are your schedules like, when are you offering care, and how flexible you are for drop-in care. Those are the things you're going to have to kind of think about as you're working with new parents that are looking for enrollments. So just to kind of summarize here, this is not going to be something that I think is going to be temporary. We've seen with the the kind of unfortunate respark of the Delta variant and perhaps other variants in the future, that the pandemic has caused almost a semi/permanent shift in work cultures across America. So that's what that's going to mean. It's going to mean the ability to support more part-time structures, which isn't necessarily a bad thing. Sometimes from just a pure revenue margin perspective in your center, that can actually, if you can make it work, can mean a little more money from you. But what it does mean is more of a management perspective, understanding what gaps you have in your schedule and being able to fill this. We know this is tricky, and there's a number of tools out there. We offer tool sets to manage that. You may use your own type of software tool to help manage your schedule. And employers are ultimately going to kind of dictate this. And to be frank, a lot of employers are really not sure what and how they're going to do, managing employees in the office or remotely today versus 6 months from now. It's really a moving target. So expect that parent schedules are going to shift as employers try to figure out if they're going to downsize, if they're going to keep their office when the lease comes up in 6 months. Are they going to shift to like a WeWork type open environment? It's really all over the place. I talk to employers every day, and you would be surprised at the type of employers that are literally getting rid of their entire office and doing a permanent work from home environment, or a work in a rented, leased kind of WeWork type of office space. They're really all over the place because this is kind of a ad hoc environment for businesses trying to figure out the best way to support their employers, which a good 30 to 40% of them are, of course, working parents that we see at our centers. Another aspect of all of this is employers have a really big challenge when it comes to working parents. This is a great article. We'll include, kind of pausing here for a second. Well, after this this webinar is over, we will send out some take-home information. It'll include a link to this really a good article in the Harvard Business Review. Childcare is a business issue, not just a family issue anymore. These stats, man, I'm going to read them out loud, but I cringe when I read them because they're just so impactful. 20% of all working parents have had to leave work or reduce their hours due to lack of childcare. 30% of all working parents have some sort of childcare backups option. That's a pretty low number. And one of the worst numbers here, 26% of women have become unemployed due to lack of childcare. We saw in some of the last job surveys towards the end of 2020, 100% of the women of people that lost their jobs in the last quarter of 2020 were women. Big problem, the big cause of that was the inability to access childcare. So that's where TOOTRiS, our company, is really focused on helping to solve. And we talk and educate employers every day. It isn't that there isn't childcare programs out there. Many times it's just that they don't know how to access it, or the employer doesn't know that with a little contribution, with a little cost sharing, they can help make that childcare more affordable for that parent, so they in turn can stay employed and part of the organization. It can cost anywhere from a year or a year and a half salary to replace an employee. So contributing a couple $100 a year towards the cost of an employee's childcare has a huge return on investment. That's what our team helps educate businesses every day on. So what is in it for an employer that does support childcare through either providing access to it, through partnering with one of your centers, or providing the cost sharing? Well, parents are statistically more productive when they're not worried about where their children are. My sister-in-law may have the best intentions in the world, but she's not a certified educator. She isn't someone that has the experience of working with children. So just because my a 6-year-old is with her today doesn't mean it's the best environment, and that's not going to give me true peace of mind. I want her with a professional early childhood education specialist in that qualified center versus having her at my sister-in-law's house. So productivity, business, this is what businesses measure, and this is what we help educate employers on every day. Parents are statistically absent almost exclusively to support children when they don't have available childcare or when they're unable to afford it. They may drop down from full-time to part-time with you as a center, and then a couple of those days a week just stay home and do care on their own. Not good for the employer, not good for the parent, and ultimately not a cohesive experience for the child. So this is what we help educate these employers on. And also having a pro-parent work environment is great for attracting talent. You've probably seen it in the news. Employers are having a really hard time attracting new employees to fill gaps in employment. If you go to restaurants, if you go to retail businesses, you'll see they're understaffed. You see that they're kind of struggling, and the staff that do exist, their hair's falling out because they're running all over the place. A big problem with that is being able to attract staff. And if you're a working parent and you're on unemployment, you've got your 2-year-old there, and you're weighing in, yes, I want to work, but I have to take care of my child, and childcare does have a cost to that. What better way to help solve that and make it a win-win-win for everybody is to help engage that employer and have a cost-sharing plan, so that way their childcare becomes more affordable, not cheaper, more affordable for the parent. That parent can then accept that job with the company that is offering that, and the child is in a childcare center. This is what we do. This is how we help educate these employers, and how we help essentially fill their open employment slots with working parents. So it's a really good thing there. When an employer does help working parents, we make sure that the payments are consistent, that employers will also, the kind of beauty part of what we do, and I'm going to jump right into the demo after this slide here, is we work with employers, tie them into TOOTRiS, and essentially deliver them to the childcare programs that are part of our network. We do this at no cost to you. You take 100% of that fee, and we bring that, if there's a cost sharing program through the employer, we bundle it into the cost of, the total cost of the enrollment. So as an example, if your enrollment fee is $1,000 a month for a preschool age child, there and maybe $500 is coming from the employer and $500 is coming from the parent, we assemble it and deliver it over to the providers that are part of our network, making it really easy for those working parents to afford care. So what do employers have in terms of options today to support working parents? Well, a couple different things. Companies right now, many companies, unfortunately, aren't doing much of anything. They can build on-site care support through a on-site center or on-site environment. That really isn't a big way to support parents, because it's unfortunately can sometimes be just a drop in the bucket. They can sign up with a childcare program that has single or multiple centers. Many of you out there may have existing agreements with an employer or multiple employers that are supporting parents enrolled in your program. There are FSA, HSA, and other tax-free financial tools out there. They have about a 5% adoption use, so isn't super popular out there for working parents. Many companies that try to offer some sort of plan do reimbursements. So you may be familiar with this, where an employer tells their working parent that's enrolled in your center that they'll subsidize a portion of that cost. You produce a receipt or an invoice that they in turn bring to their accounting department and get reimbursed with that. TOOTRiS ultimately does provide a real-time access and cost sharing. So that's what we're going to demo here in a moment, where we actually help make childcare more affordable by partnering with that working parent's employer and getting them involved in the enrollment process. So that way the childcare, we were able to drop that cost, but there's no paperwork or kind of management for that. Really quickly before we jump into the actual demo here, we're a startup. We were founded in September of 2019. We are a women-owned and led business. Alessandra Lazama is our founder of our organization. She grew up as a mom facing the challenges of childcare here in the United States, and this is something that we've been working and building to help essentially address those challenges. She's also a former Montessori teacher, so she understands what it's like to help educate and guide children. And our real mission in life is to make sure that every working parent, especially women, have the same opportunity for advancement, and that every child has the access to quality childcare. So without further ado, Storm, I'm going to go ahead and stop sharing just for a second here and go ahead and switch right over to my TOOTRiS demo. Hopefully you can see my screen here.
Yes.
Perfect. Well, PowerPoints are exciting. Not really. I like to go ahead and dive right into a demo. So if you haven't been to TOOTRiS.com, that's okay. When you visit the site here, you'll be able to see exactly what I'll walk you through here today. We are an online technology resource. We have native mobile applications available for iPhone and Android for both parents and providers. I kind of mentioned earlier, we are a resource for parents and families looking for affordable and available childcare. We also provide a full management suite, tools, online marketing assistance, and other interesting things to childcare providers, big and small. And how we really kind of monetize our business operations is providing childcare as a benefit to employers. So essentially, we work with employers of all sizes. We have employers that have 10,000 employees. We have employers that have 10 employees, and we build a turnkey childcare solution so they in turn can provide contributions, tools, and other support for their working parents. We feel it's long overdue that employers help their staff with childcare and family resources, and that is our mission in life, to help engage them, educate them, consult them, and ultimately bring that plan on, which we completely manage. And it's a beautiful thing. I want to show you really quickly here how TOOTRiS works from a parent perspective, and then I'll kind of flip the hat and show you what it looks like from a provider perspective. But I think to understand it is really more on the, let's start with that parent perspective. So once a parent signs up through their employer, they receive information about TOOTRiS, they come to TOOTRiS and create their account. The first thing they do is do a neighborhood or geographic search, which any modern parent wants to look for care around their neighborhood, around maybe where they work, to find a provider that fits them. They can do this by geography, so we can search by state. You can search by zip code. I'm in Point Loma, so I'm going to go ahead and search the Point Loma area here in San Diego, which is a neighborhood. Once the map loads up, you've got a nice interactive map here. You've probably seen maps like this on Yelp, Zillow, etc., where you can move around the map. You can redo the search, repopulates a number of icons here on the left-hand side with cards on the right. So let's talk about this for a few minutes. Parents are looking for care in and around their neighborhood, in and around their work environment. So let's show them the providers in our network that are available to them. Again, no cost, no contract to join TOOTRiS as a child care center. We try to make it as easy as possible because we want parents to have the access to quality providers like yourself. So the icons, you see a couple different icons here. The houses are signifying that these are in-home providers, and these little yellow buildings here are child care centers. On the right, there's some really key information here. I want to focus on three things that the parents love about TOOTRiS. First is the real-time availability here. You see these green buttons. We actually display how many slots are available in these programs. And we use some proprietary magic that helps you, the childcare provider, keep track of this data so we can understand it and then promote this to parents what's available now. And we can actually do that up to a year in the future. This is key because, at least in the state of California, I'm not sure where many of you are in, but in the state of California, the average amount of phone calls it takes from a childcare provider to find and connect with a parent looking for care is about 80. So as a parent, I have to make 80 phone calls before I am enrolled in a program. That's a lot of calls. That's a lot of pain. That's a lot of voicemails. You're returning voicemails and leaving voicemails on their phone. And this is all done during business hours when an employer is worried about their employees' productivity. So that kind of ties back into why we're doing this. And the real-time availability is really key for them to understand what's available and find a program quickly so they can send that enrollment request. The second piece here is, okay, I'll zoom out here in the Point Loma area. I've got 448 programs in and around this area. How do I find information quickly? Well, how do I find the program that fits my needs? We have over 100 unique filterable attributes so parents can find a program. Of course, things like based on age and provider type, but also what's important, maybe language, maybe they're certified by the NCCA. I'll use language as an example. I'll pick Spanish here. So I'm looking for a program that is bilingual, English and Spanish. About 20% of all programs in California have a bilingual support. We were looking at about 400 programs. We're now down to 50 programs that are bilingual English and Spanish speaking in my area. So that helps kind of whittle down that search time very quickly here. And the third really popular feature for parents is our comparison tool. So I've got this little comparison box here. I've got the Rising Star preschool. I'll compare it with this program, and let's see, this preschool, and then maybe I work near the international airport, so I'll go ahead and select this provider here. I've never compared these programs before on a demo. We go ahead and build that view side by side. So as a parent, I can see and contrast each one of these programs next to each other and find the one that best suits my needs. I see their availability up top. I see 3 of them are centers, 1 is an in-home environment, and I can kind of go down each of these distinctions to understand things like experiences, things like language support, things like their activities, meals and diets, et cetera, et cetera. This helps providers find care that suits their needs. I'm sorry, parents find care that suits their needs quickly and easily through the platform. By the way, this can all be done on a mobile phone. I'm just doing the demo on a browser because a mobile phone would be a lot smaller. Once a parent has found a couple programs that they like, let's look at some profile pages. So this is, we'll look at, we have different types of programs here. I'm looking at a Childcare program. We've got, what is this, a YWCA program. So we've got all sorts of programs, different shapes and sizes here. I'll look at, we'll do, let's see, the Say San Diego Early Childhood Center. This is a Boys and Girls Club. This center here is based in Serra Mesa. All of our profile pages are essentially the same here. Lots of good information for parents, starting with a nice photo carousel. So we allow programs to upload some beautiful photos of their program, a picture of their director if they'd like, and if they want a video of the director or the owner.
Nancy with Say San Diego.
This is Nancy telling us a little bit more about her centers. I believe she has 12 here in San Diego County. On the left-hand side, we have all sorts of helpful information about the program, about what their activities are, kind of a day in the life. In the center, we've got information about mostly core information, their licensing information, hours of operation, etc. And on the right-hand side, we have key engagements. Again, this is all completely free for you as a child care provider. We allow parents not only to search in their area, looking for care, find and compare providers, but also send them a message request. Maybe there's something that they want to know specifically about. Maybe they would like a callback request for, at a certain time that would make sense for them. And they can also upload a video and actually show, if they'd like, a little bit more about their childcare center. It's a cool little mural there. This program has uploaded a video about their program, and this helps me as a parent without yet even stepping foot inside their center, without even picking up the phone and bugging them in the middle of their day. I can learn so much about this center and how great it is just by using TOOTRiS here. I can also schedule tours, and ultimately I can send an enrollment request to this provider, all using TOOTRiS. So I'm going to actually switch over to my test profile because I want to show everyone what that looks like. This is Clementine Daycare. Clementine is not a real childcare program. Clementine is the name of my cat. And I wanted to show how this looks like from a childcare perspective. Keep in mind, we actually allow you as the center to offer all sorts of shapes and sizes of enrollment availabilities, including but not limited to drop-in care. If you don't support drop-in care, this just isn't available. But if you do, this box will essentially pop up here. So, and we're going to get to how we tie in employers here in this enrollment. So this is a test profile. Usually childcare is more than $2 a week. So I'm going to go ahead and click this here, and we're going to start this enrollment process. So we're at this enrollment screen. We're going to go ahead and start this application here. I am at the enrollment request window. I'm logged in as my test parent. I've got a couple children here that I've added under my account. I've got my daughter here, and I've got this little handsome guy, Eric Jr. I'll go ahead and start with Eric Jr. We do a quick check to make sure that Eric Jr. is compatible with you, the childcare provider's age and requirements, things like potty training, etc. Eric is definitely potty trained by now. And we're going to go ahead and look at the enrollment cost. Again, this is a test program. This is all test monies. So care is at $2 a week. We'll go ahead and click continue here. We'll set up the schedule for, let's say, Monday, Wednesday, and Friday. And we'll do an afternoon care. Really easy to do. This can be done off mobile phone or an iPad or anything like that. And now we're at the kind of price review page. And what you didn't see is that this test parent that I'm using here is an employee of the Awesome Company. And the Awesome Company is a client of TOOTRiS. So this is a demo on how we bring in employers into TOOTRiS. And what we're showing here is that Eric is why his enrollment was $61.80 out of pocket, because he's getting childcare benefits through his employer. His employer is actually contributing 50% of that, taking his out of pocket down to $30.90. Now you as the childcare provider see 100% of that enrollment fee. We assemble this on the back end with the employee, and I'm sorry, the employer. So we essentially are making childcare more affordable for the employee without making it cheaper for you and lowering your enrollment fee. So if your enrollment fee is $61.80 a week here, like Clementine Daycare is, you receive 100% of that. We just compile it in the back end and take part of that from the Awesome Company and part of that from that working parent, making it really easy for everybody. You don't have to bill the employer. You get that payment right up front when you accept that enrollment request. As an employee, I can go ahead and click here to view my childcare benefits. So I'm getting benefits with the Awesome Company. I see all my core information here about my contact information with TOOTRiS. I see my benefit summary here, which helps me understand when my benefits start and end, just like a healthcare benefit, just like a dental benefit. Childcare benefits with TOOTRiS are no different, really easy to access. I can see all the core information here, including my annual allowance. And this is kind of the average of what employers with TOOTRiS will do from a cost sharing perspective. They may contribute $100 a month. They may contribute 25% of all childcare. Regardless of how it comes out at the end of the day, they help make childcare more affordable for parents. Parents now can enroll in your program without having to, go in the red on their credit card. You don't have to adjust your fees to help meet this parent's needs, so you can get paid what you deserve, so you can pay your staff what they deserve. It's a kind of a win-win-win for everybody, and this is really what we do here at TOOTRiS, getting those employers involved. Once we finish this portion, we're going to go ahead and upload this application here and make sure that this program has that all the information from the employer, and we'll go ahead and finalize this here. And now I've sent the enrollment request to the parent, to the provider, so they have that new enrollment request from TOOTRiS through Eric and Eric Jr. here. We're now at the point where I'm going to go ahead and switch over to the provider perspective, but before I do, I think I see a couple questions here. Let's see. Oh, there's just more about sending in the information and those red lines. I noticed that too. Yes, Laura and others will go ahead and send some information and helpful resources after this is over here. Before I switch over into the provider perspective, I do want to just really quickly show you what it looks like from the parent account. There's my daughter here. I've added my children information. There's little Eric Jr. There's my mom. And there's my wife and guardian of the two children here. Just like any other type of application, I have all the information I need. I can see as a parent all my payment information that I paid to Clementine Daycare. This is really helpful to give to my tax person to make sure I get that childcare tax credits and have all this tracking information here. Now I'm going to go ahead and switch over to the childcare provider view. So hopefully you can see that screen here.
Yes.
And so thank you, Storm. Keep me in track. So we are now looking at TOOTRiS from your point of view. So every childcare provider program that is part of TOOTRiS has an account, has a dashboard. It is really easy to configure, and it's essentially built in 3 different portions. And there's a giant seagull outside of my, there's a seagull here, pecking in my window. So every provider has these really easy accessible tools on their mobile app and on their desktop. They can see the core information, starting with the information that parents see. This is the about, this is the hours of operation. I can upload really quickly new photos and different things to help make my program come to life to those employer parents that are logging into TOOTRiS and finding my center to send me enrollment requests. All of this information is pretty easy to do. As you can kind of see, I'm on the enrollment schedule. I can very quickly adjust my enrollment schedule. Now, most of this is set it and forget it. From an availability perspective, this is how parents see what's open in your center. You may not publish all of your availability. Maybe you just want to open up a couple slots into TOOTRiS to make sure that parents see what you have open in your center. And this is how ultimately parents will go ahead and find that availability in that search page I showed earlier and send you an enrollment request. How do those enrollment requests look? Well, let's go take a look at one here. I'm going to go ahead and click on the Enrollments tab and see that I've got Eric Jr. here. We just created this enrollment request a few minutes ago. It's starting on August 23rd. I can go ahead and view that application. I can click accept or reject, or I can reach out to that parent for more information. What TOOTRiS does is really connect you with that parent. So you have that connection, you can enroll them in whatever existing processes you have. And in this case, if they're coming through an employer, you're going to be paid just the same as if they were paying with their Visa or MasterCard, except we would assemble on the back end that employee portion. So again, this is how we're really pushing to make childcare more affordable for parents without making it cheaper or without taking a percentage of your enrollment fee. We don't think that's the way to do things at all. Instead, let's help educate those employers so they can in turn contribute to these parents out there and give them a portion of the total enrollment cost. So you go ahead and receive that with this enrollment request. So what an enrollment request is just that. You aren't obligated to supply care to this child until you click accept. And once you click accept, it essentially will be sending you that enrollment fee a day prior to every enrollment window. So if you bill on a monthly basis, as an example, on the 30th or the 31st of the prior month, you would receive that monthly enrollment fee from TOOTRiS that would maybe be a combination of a subsidy, maybe a combination of an employer's cost sharing plan, and maybe a combination of the employee, that parent's bank account or their Visa card information. This section is also where you receive tour requests, and you can see history. I've got, this is my test account, so I've got a lot of existing requests from Eric Cutler. He really wants to enroll in Clementine Daycare. We also in TOOTRiS can manage and see earnings. So this is really helpful from a cash flow perspective. So I can see here that I can see all my total earnings to date from TOOTRiS. And I can see that this goes back, I only have one child enrolled. This is Nola Cutler. I can see all the way back into November. I can see all this banking information. And if I click on one, I can see that this is for this enrollment period. I can see it was deposited in my bank account. And again, it was for $12 there. This is a test account. I'm sure your enrollment fees are slightly more than $12 a week. I can also see upcoming earnings. So this is really helpful from cash predictability to see what's coming from TOOTRiS. We can see that hey, I've got upcoming earnings starting on the 8th. I'm going to go ahead and get $12 from NOLA Cutler's weekly childcare, and I can see what my 30, 60, 90 days looks like. This is helpful from just understanding what TOOTRiS is sending over to me and helping me ultimately kind of predict what TOOTRiS is going to provide to me from an earnings perspective. We make this really easy. The total amount of time it's going to take you to set up a center on TOOTRiS is about 15 to 30 minutes. It's really as much as you want to configure your page to make it look and be the most attractive out there for parents looking for care. This includes things like providing that tour video of your center. What does your center look like? Right now, over the past 15 months, you're probably not too interested in in-depth in-person tours. I know centers that literally will not accept parents outside of their front doors, prospective parents. Having a video of your center in TOOTRiS is a great way to help alleviate that, and a great way to help kind of showcase your program. You can also use this if you have a website, if you have social media. This is a great way to put it out there. The cameras these days on your mobile phone are super high end and can take really great quality videos at a high level camera equipment with zero budget except having that iPhone or Android. So all of this information is pretty easy to update and add to TOOTRiS. And the benefit of this is we put your profile in front of the employer's staff that are looking for care. We're currently in 23 states across America and growing. So if you haven't had a chance to do that, please visit TOOTRiS.com. There's a sign up button on the top right side of the screen, and you can go ahead and create that account, and ultimately that will go ahead and produce this dashboard here where you can update that information and
get that liquor.
Oh.
Sorry, Eric, go ahead.
It's okay. The fun parts of having everybody on the call. So with that, I did want to leave a few minutes here at the end of the hour to open it up for any questions from Storm and team, as well as folks on the call. You can go ahead and if you'd like to type that in. I don't know, Storm, how do you like doing your Q&A?
Hey, Eric. It really just depends on the participants. If you guys have any questions, you can chat them in now. You also have the ability to unmute yourself. If you scroll over with your mouse, a little pop-up will occur at the bottom of the presentation. The mute button or unmute button is all the way in the corner on the left.
Hi.
Hello.
Hi. It's Ravon the little guy calling from Jacksonville, Florida. Wow. Wow. I just shared it with about 15 colleagues. This is an awesome website. I stay in Hawaii, but I come and go. But here in Florida, I have shared it with about 15 of my colleagues. This is awesome. Really is.
It's wonderful.
Thank you.
Well, thank you. Thank you for sharing that.
Hi, this is Jane Simonson in Cedar Rapids, Iowa, and I'm on a child care coalition because, like everybody else, there's a huge child care crisis here. And I'm just wondering if there is a video or if you ever do things live for employers, like if I or someone else was to go to a group of employers to share a presentation similar to this.
Absolutely. So yes to both. We have pre-recorded videos. We'll share out some kind of takeaway information after this call. Now that we've got everybody in the room, virtual room, we'll send out that information, and we're more than happy to do education, live education with an employer or organization. We do this every day in, day out. Really, employers come to us. There's a stigma that has persevered for years, that you have to be a, Microsoft or Sony or AT&T to help your employees with childcare. And when you do that, it's only building your own childcare center or something like that, which is so old school, it's not even funny. Really, any business of any size can do a lot to support their working parents. And we spend our time predominantly talking to the small, medium, and large businesses out there on the steps that they can do to do that. There's IRS tax credit benefits for them. There's so many centers out there, large and small, that have availability, part-time, full-time drop-in, that can support their working parents and make it so much easier for them, but they just don't know. So we spend a lot of time consulting with them all across America. I would love to be able to do that with your association, Jane, and any employers you're talking to, as well as provide some kind of canned information that they can view on their own time.
Awesome. Thank you so much.
Eric, is it okay if I share your contact information in the chat so Jane can follow up?
Absolutely.
Perfect.
Was there anything, oops, pause my screen here. Do we have any other questions here before we send out some more information and some takeaways? Storm, anything on your side?
I don't have any direct messages here yet. Just another appreciation for the presentation and that she's sharing the link to the website. Feel free to unmute yourself. You can also chat in a question if you're shy. The chat button is located in the center middle of the bottom of your screen. I also just shared Eric's contact information. Please feel free to email him directly to arrange a meeting or a call. We really want to get your family's employers engaged with TOOTRiS to see how we can best benefit your families through this awesome program, which NCCA finds really innovative. It's nothing that we've seen before. And the way that Eric and his team have put together this system is really with providers in mind first and foremost, your success.
I do have one more question. Do you work with states? Because I only accept childcare assistance because my center is for low-income families. And do states sign up and give payments to you as well?
That's a great question, and I didn't talk much about the various subsidy plans, from direct financial to nutrition plans and kind of everything in between. There are no shortage of local, regional, state, and actually national plans, as I'm sure you could school me there, Jane. We work with many programs out there and are kind of adding them on every day. There's national plans like the Head Starts of the world to much more smaller plans. So absolutely, we can help a program that only works or maybe partially has programs, subsidy programs that are supporting a percentage of the enrollment fee. That's another big, for me, a big challenge that needs to be overcome. Every year, monies that are designated to help parents and at the same portion providers with the cost of childcare get thrown back into the the kind of bank accounts of many subsidy plans out there, because there isn't a mechanism to deliver it to the parents. So we try to be as educated as possible, and we're learning about new programs every day to help parents make childcare more affordable to them. We are working with a number of different states at the state level, and I'd be happy to understand a little bit more, Jane, on a call with you, what you are working with in particular in your state.
Sure, great. I would enjoy that too.
One other thing that I did want to mention, and this will be in the follow-up material, that one of the first things we recognized at the start of COVID was that childcare programs and parents, to a certain degree, were pretty much left in the dark in terms of how to, properly support, equip themselves, the children, and their parents with materials and also PPE. So one of the things we have been doing for the last 15 months, and we're still doing to this day, is providing centers across the US with what we call safety kits. No cost, no obligation. You don't even have to have a TOOTRiS account if you don't need one. We'll provide you with masks, gloves, and wipes, disinfectant spray, things like that, if you need them for yourself, for your staff, for your children, for their parents, right? This is, a rising tide lifts all boats. We're not going to get out of the current situation if we don't have the materials handy. So if anyone on this call or a center that is maybe a little under-resourced when it comes to things like masks, the link that'll go out today, probably from Storm or someone on this call to you with all that follow-up information, will also include a link to essentially add whatever your mailing address is, if you'd like one of these kits, and we can go ahead and provide that to you. Again, it's at no cost. We do a couple hundred of these a week, and we've been doing them for 15 months because, again, we know that some centers are a little harder hit than others when it comes to having those supplies.
Thank you, Eric. What a great resource to provide to our frontline providers, because that's really what you guys are. You've been essential this whole time. You've been open this whole time. So we really appreciate all your dedication and making sure that the backbone to our economy is there, which is you guys. Lindsay, I'm sorry to see your connection's not working. It is being recorded and will be sent to you via email, today's presentation. And Eric has picked our winner. So Eric, if you wanted to announce the winner.
You're putting it all on me?
Yeah, come on, it's your iPad.
I did not pick it. This is done at random. We have a little random tool here. And the iPad winner is, I'm going to try to say this name, Kalina Wint.
Oh, Kathleen, Kalina?
Kalina. Oh, that's her. She just said thank you in chat.
Perfect.
I said it correctly. All right. Yes.
We will connect with you and get your contact information so that Eric can mail that on out to you, okay?
Yes, we will. Let's see. I'll just put the safety kit right now in chat. I can do that. You don't have to wait for that. Here, I'm just putting. Someone asked if I could send out the information about the safety kit, which is the PPE. I put that in chat, so you can hopefully see that now. All that's required is, I know that sometimes you have maybe a PO box that you accept mail, and then your actual center. It's about the size of a shoe box, give or take, depending on how big your feet are. And we put masks, gloves, wipes, sprays, things like that in that box. So if you need it, go ahead and click that link in chat, fill out that information, and we'll get that over to you in about 1 to 2 weeks, depending on kind of where you are.
Perfect.
And that is all I had, Storm.
All right.
Thank you, everybody, for attending here. On behalf of myself, thank you for the invite. National Childcare Association and NECFA. I'm going to provide some information at the end of the day here, so you have all that, and include my contact information as well. Please feel free to reach out regarding anything that I can help you with.
Thank you so much, Eric, and thank you for the valuable service that you and your team are providing to our frontline workers, our childcare providers across the nation, and engaging those employers to make care more affordable to our families that need it the most. We'll look forward to connecting with everyone again soon in our upcoming webinar Wednesday in September. Please be on the lookout for that email, and be on the lookout for the follow-up to today's presentation with the recording and those juicy resources.
Thank you,
Thank
everybody.
Thank you, everyone.
Bye.
Have a great day, everyone.
You as well. Bye-bye.